When I noticed that I was having a problem is I noticed that my right foot, my toes, would be colder. And for some reason, I thought, no, that doesn't seem right, for my toes to be colder on my right foot as opposed to my left foot. So that's when I went to, my doctor decided to refer me over to the PCI building for Dr. Lawrence. The first time I met Dr. Lawrence, I thought he was just a little sweetie pie. So I thought him and I are going to have really good rapport.
Well, Gloria is a fairly typical vascular patient in that what we call a claudicator. Claudication comes from a Latin word. It means to limp, and these are people who have blockages in the main artery in their leg, and because of that, they get pain after they walk a certain distance. They get pain in their calf. They stop walking, the pain goes away in a little bit.
And then he informed me that I had to have my angioplasty.
We had treated her with a minimally invasive procedure, an angiogram and atherectomy, where we removed some plaque and opened up the artery a little further with a balloon.
But it went really, really well, and I was very pleased with it, and I felt very important. They had me come back and have a recheck in 3 months, and so it had started to close up already again. That's when Dr. Lawrence said, well, my dear, you're going to have the procedure again.
At the same time, we were developing this new office-based angiography room here in the PCI Medical Pavilion, and we were getting ready to go online and have our first case, and she struck me as an ideal patient.
The second time, it was a lot easier because it had been opened, before. I had to pay $1,200 out of pocket for the procedure at the hospital, as opposed just for a $30 office copay.
We're seeing that the cost of the healthcare system is decreased by around 30%, sometimes more. And the individual cost of the patient, where they may have had a co-insurance or a significant deductible payment, in many cases the only out-of-pocket expense for a patient is an office copay, no different than if they'd come in to have their blood pressure checked.
Because I was the first procedure done in the imaging for that angiogram, then Dr. Lawrence took it of himself to see about getting me flowers. And I thought that was very precious.
It's very gratifying to see patients in follow-up after they've had an intervention and hear them tell me that they can walk their dog without having any pain, that they're able to play with their grandkids.
The building pretty much covers anything that you require for any type of a procedure.
Almost every patient that we see has spoken very favorably about the building, about the ease of its use, about the convenience of imaging, laboratory, office setting. Many people have heard the phrase medical mall, and when you walk in here you get that sense. It does feel like that a little bit. The collaboration is very helpful, and especially being under one roof.
At PCI, Dr. Lawrence is my choice, and that's very important to me.
I think what I want patients to remember about their experience with PCI, we want them to have the best outcome possible. We want them to be happy about their experience, give them that sense of being special. We think they're special.
If you know that your doctor is doing his best to take care of you, and he makes you feel important, and to fix you up and heal you and mend you, that means a lot to a person.